Kano State, located in northwestern Nigeria, like many other parts of the world, Kano has experienced outbreaks of various infectious diseases, including cholera, meningitis, and Lassa fever, among others. And in recent years, Kano has also been affected by the COVID-19 pandemic and diphtheria disease still in control. To respond to these epidemics, the Kano State government, in collaboration with the Nigerian Federal Ministry of Health, NCDC, WHO, and other partners, implemented an action plan for health security with measures aimed at preventing, detecting, and containing infectious disease outbreaks in the state. These measures include robust disease surveillance system to monitor disease outbreak and detect early cases, trained rapid response team that can quickly investigate suspected outbreaks and respond on them, routine vaccination campaigns to prevent the spread of vaccine-preventable diseases, awareness campaigns, and provision of medical supplies and equipment, among others. Lack of funding also can lead to inadequate resources for healthcare systems and research on potential treatment, which can increase the likelihood of spread of diseases. Adequate funding, on the other hand, can help provide the necessary resources and infrastructure to prevent and control epidemics. According to the Global Health Advocacy Incubator, GAI, in December 2021, Kano State significantly increased fundings for epidemic preparedness and response (EPR), and 3 million naira monthly was approved and captured in the fiscal year 2022 state budget, which made it 33% increase in fundings for Kano Epidemics Preparedness and Response budget line created in the 44 local government areas within Kano State. Dr. Abdullahi Oramata, the Kano State epidemiologist, sheds more light on what has changed from the time of the first release and how these funds are put into use.
I can authoritatively say that from the time this standing order was approved to date, the releases has been regular, because these releases are coming from Kano State Health Trust Fund, which is a basket fund set aside for financing of the healthcare system, and out of which this amount is now being remitted to the EPR activities in the state. So the releases has been regular.
In an offline interview, the Director of Budget, Ministry of Budget and Planning in Kano State, Yakubu Sabiu Garindanga, said Kano State health financing budget is still within the accepted budget allocation. Despite the current economic challenges, Kano State has achieved above 15% allocation to the health sector in 2021 with 16% and in 2022 with 17%. Mr. Sabiu went further to say that due to the Kano State government's need for health security in the state on epidemic diseases, the monthly releases is timely. According to Kamet TV findings, the 3 million naira monthly allocated for epidemics preparedness response is being put in use and the releases are timely. However, like many other parts of the world, there is always room for improvement, and ongoing efforts are needed to strengthen the state's capacity to prevent and respond to infectious disease outbreaks. A visit to the Yusuf Maitama Sule University Teaching Hospital, situated at Dawaki Nkudu local government area, which hosts the Kone Dawaki Isolation Center, one among the major facilities used during the heat of COVID-19 pandemic, showed deserted 70-bed space facility abandoned after the heat of COVID-19 pandemic. Apart from the power inefficiency, such center is supposed to be provided with solar energy and adequate water supply as standby measures, part of epidemic preparedness response. The story isn't different from the first known isolation center in the state, the Ergaya Isolation Center, situated at Ergaya along Wudil Road in Kano State, though a bigger center is seen under construction adjacent to the Ergaya Isolation Center. With myriad of issues affecting effective epidemic preparedness response, there is need to have a standby functioning isolation center. Also, there is need for at least 3 staff for administrative restrategizing that will improve management of the structure by implementing a rigorous system of control and management that will ensure surveillance and supervision, in addition to training and retraining of staff on best practices in handling the centers to ensure preservation and longevity by using part of the EPR funds piled up in the treasury. Khadija Ishaq.